cough syrup containing codeine worth over 20 million rand was recovered. The medicines were destined for neighboring Zimbabwe. Earlier this year, ARVs and other medicines were also found being transported illegally to Limpopo after a bus crash exposed the shipment. Mokgadi Fafudi from the South African Health Products Regulatory Authority joins us now to discuss this story. Good morning. Thank you very much, Mokgadi. Welcome to the South African Morning. Now, as the regulatory authority, are you concerned that such huge quantities of medications are being found, apparently being illegally put together in Johannesburg?
Greetings, Braden, to you and to your viewers. We are very concerned about this, Braden, and we have since collaborated with the police and also the South African Pharmacy Council and other colleagues that are involved in ensuring that the handling of medicines is in accordance with the law. So we are very concerned, and we have then since started the investigation to look deep into this, and we have already established where the source is and also the pharmacies that are also implicated in this, and we are working together just to make sure that we will protect the public and ensure that this investigation, as we do not have arresting powers and also prosecuting powers, but just to ensure that we get to the root of the problem and work as a collective to get to it.
Okay, two questions out of that answer. Who are these suspects? You said you know who is behind this, and you say there are some pharmacies or pharmaceuticals that are involved. And how big is this network?
We have not yet gotten to the root because remember we have just found out. So we have linked certain pharmacies to this. Remember, we have to look at, there are some paperwork that as we were looking into this, we got hold of, and those papers are telling us where this comes from in terms of where was it bought and who has bought it. But because this is still an investigation, we have to be very cautious because there might have been a hijacking or something else might have happened in between where this is coming from and the destination. But what I'm saying is that we were able to link where this is supposed to be and where it is coming from, and we are trying to then holistically look at all the angles to make sure that this was not a deliberate move, or just to establish exactly what was supposed to happen here. Because, Braden, we have got very stringent regulations when it comes to medicines, especially these ones, because they are habit forming. And we already know that even locally, there is excessive use, which is diverted to the illicit market in the form of giving it to the youth. And then in terms of exportation as well, there are rules as to who can export. Those must have a license, and the medicines must be authorized to be exported.
I mean, codeine is highly addictive, as you've said. I mean, the cough syrups, and there was many issues around codeine for some time here in the country. As a regulator, you've got oversight, in terms of the pharmaceutical health, the health products. What else can you do, as you've now become aware that there is some kind of illegal distribution network that's at play here?
We have recently launched the National Action Plan on fighting this kind of activities. This is a collaborative task team with law enforcement agencies, with the pharmaceutical establishments, the supply chain in the pharma industry, and also including the civil society, the Central Drug Authority, many other key stakeholders and professionals, where we will be ensuring, and government as well, where we want to make sure that collectively we prioritize these activities and ensure that we will prevent and also respond and also detect these in the market and action them accordingly to ensure that, especially like where it comes to enforcement will happen accordingly, and then we will have prosecution of this, because we cannot tackle them in our silos. But Our minister has successfully launched this end of September, and effective now going forward, we will be actioning the priorities that we have listed, and this is one of those priorities.
Okay, Mokgadi, we'll touch base with you, I'm sure, in the near future. As we head towards the festive season, our land borders tend to be very, very busy, I guess. All vigilance and law enforcement is going to have to happen to make sure that this doesn't carry on. Mokgadi Fafudi, South African Health Products Regulatory Authority. They're still investigating. They've got some papers to show that this could have been possibly bought at some pharmacy and then hoarded, whatever. They're not sure for what purposes, but was it really hijacked along the way, or it's an illegal distribution network?
Well, we'll wait for the conclusion of that investigation. That's how we wrap up this hour of the South African Morning.
Yeah, the top headlines, the top stories, the headlines at the top of the hour, coming up at 7 o'clock into the second hour of our Hum Day edition. But weather-wise, it was a misty start in northern parts of Johannesburg. Here's a quick look at your weather.